All right, good evening. Man, this has been a busy day for shows here today. But good evening. I want to welcome everybody to the Coronavirus Update Show. We do this every Monday and Wednesday, 6:15 p.m. I'm joined by the ever diligent and constantly researching Nikki Barron. How are you?
I'm good. I'm good. How are you?
I'm all right. I'll be honest with you. I'm tired. I mean, I think most people who watch Converge, they follow us throughout the day, so people know it's it's been a long day. It looks like it's probably gonna be even longer evening, but I'm good. And this is especially around COVID and everything that's going on here. This is a topic that we can't let just get pushed to the side, especially the way that these numbers have been going.
Yeah, definitely. I know the whole team. We were all up. We were all up until like 1, and then up at 6 again today, preparing for the live broadcast from Cal Anderson. So, are you planning to go live again tomorrow morning from the park?
So just an update there, and actually we're gonna have another show around 8 o'clock tonight. So what's happened is that I briefly I'll tell everybody that Judge Jones did not make a ruling today on the temporary restraining order that was presented on behalf of a plaintiff that was there in Cal Anderson Park. The judge said that he was going to basically possibly make a ruling tonight, but most likely tomorrow, and at the latest on Thursday, which means that there won't be a sweep, although SPD isn't barred from sweeping, but I think it's highly probable, highly unlikely that Seattle Police Department will sweep tomorrow morning based upon what's going on in the courts. So hopefully we'll be here in the studio.
Yeah, I heard on KOW today, they actually interviewed somebody who was at the park this morning, and they were expressing that one of the main reasons that they want to stay at the park is that they don't feel COVID safe in a shelter, which I think I kind of knew, like somewhere in my mind, but it was really good to hear specifically from somebody who is unhoused about their concerns surrounding COVID and the lack of social distancing that they feel they can have, and they just feel safer being in their own tent outdoors. So,
Right. And before we get to the numbers, maybe you can tell everybody about our guest for this evening.
yes, we are here with Dr. Jeff Duchin. He is the Seattle and King County Health. I'm trying to get his title exactly right. It's really long. It's so long that when I tried to put it into the system to have his title when he comes on, it wouldn't even take it, which I was like, oh, okay, that's a long title. So he is Dr. Jeff Duchin, Public Health Seattle and King County Health Officer. And yeah, he's the person in charge of our safety when it comes to COVID and all these numbers and all these charts and everything. So I'm looking forward to getting to ask some questions surrounding COVID in general for King County and Seattle, but also questions about the disparity in race and outcomes, as well as the vaccine, because I know some of our frontline workers got their vaccine started yesterday. The military base in Tacoma started getting theirs. So it's going to be a really interesting conversation.
All right. Yeah, I'm looking forward to it. Actually, I got quite a few questions for Dr. Duchin. Um, but before we get to the good doctor, then, man, why don't you talk about the numbers right now going on for the state of Washington?
Yeah, so our numbers, let me pull up my math that I already did. So confirmed cases rose by 1,272 cases, bringing us to a confirmed total of 205,069 confirmed cases. And I saw an alert on there that said there may be up to 1,500 duplicate cases. The data kind of ebbs and flows as it gets cleaned up, as everybody starts, turning their stuff in. Hospitalizations rose by 124, bringing us to a total of 12,773. Our deaths rose by 35, and that brings us to a total of 2,953. And the numbers that are really important to me are our readiness, and you and I were talking about this earlier. I was just driving in my car and I was listening to NPR, and they did a story on my hometown, Abilene, Texas. And there's actually a very big hospital there, Hendricks, and they're at 130% capacity, and people are getting, intubated in the emergency room. There's people, it's just a situation I've never seen. I'm from a pretty small town. So it was pretty alarming to see that, but it was also really nice to know that our hospitals are not at that capacity. And I'm really grateful to the hard work that the healthcare workers have done, and the people who work in public health, as well as everyone who's covering these stories and keeping this top of mind, because our current hospital readiness is actually hitting our goal of staying under the 80%, and we're at 78.6 for hospital readiness. So that,
well, they dancing around that readiness. I remember the other day it was up to 81. That's just 78, huh?
Yeah, but I mean, and it's a lot of beds. Even just 1 or 2 percentage points, and then also to know that between 80 and 100, and there's places like small towns in like rural areas like Abilene, Texas, that are 130%.
Right.
That's pretty scary. So it really made me feel a lot better about where we are as a city, and where we are as a state.
Right. Well, I mean, one thing that we do know is that compared to the rest of the country, Seattle is one of the leaders, or I guess however you want to phrase it. Everybody else has more COVID than us. If you look at the top 30 cities, the biggest 30 cities in America, then we have the lowest rates of this and lowest rates of that. And the actual municipality fares very well. But one of the things I want to talk to Dr. Duchin about is, once you leave the city limits and you head south, man, the numbers get real different, especially in South King County. And some of those numbers, they shoot right up. Speaking of numbers, do you have any other numbers for me before we go to break and come back with Dr. Duchin?
Nope, that's the numbers for today.
All right, we'll take a quick break right now. We come back. We've got the good Dr. Duchin. You're watching the Coronavirus Update Show. All right, welcome back to the Coronavirus Update Show. My name is Omari, Salisbury, joined by producer Nikki, Barron, and we welcome here to Coronavirus Update Show Dr. Jeff Duchin. How are you this evening, sir?
No, I'm doing all right, Omari. Thank you so much for inviting me.
No, it's good to have you here. And like Nikki says, you have a very long title that can be complicated. So why don't you break everything down for our viewers? What exactly do you do?
Okay, so I'm a physician. I was an emergency medicine physician initially, then internal medicine, specialized in infectious diseases, worked at the Centers for Disease Control and Prevention, became a medical detective or an epidemiologist, and dedicated my career to public health because as an ER doctor, I got really frustrated and tired of seeing people come back in with the same preventable things day after day. And I wanted to make more of a difference on the population level. So here in King County, I oversee currently the coronavirus response, but before COVID, it was both our communicable diseases of all types, our infectious diseases, could be foodborne, E. coli, salmonella, hepatitis, you name it, and working with our teams across the board to help improve health outcomes from chronic diseases, accidents and injury, and opioid use was a big one. And before COVID, I was hoping to spend most of this year working on climate change and preventing drug overdoses. So a broad spectrum of responsibilities, working with a really great team here at the county.
All right, and that is a lot. And thank you, because you broke it all the way down. And for the purpose of this conversation, though, you're the top person there at the county in regards to COVID.
Well, you can say that. I mean, yeah, we've got a lot of really important people working throughout the department. But
Well,
I try and help.
I'm sure you do. You know what? And you know, this show is usually only like 15 or 20 minutes because it's a quick update. But you know, we got lots of questions for you, and so I hope that you don't mind maybe giving us a few extra minutes because
No,
it's some important
definitely.
questions that the community wants to talk about. I'll throw it over to you first, Nikki.
Yeah, I like the calling you a detective. I feel like that's a really nice way to understand what exactly you do. But I wanted to jump right in and ask a question around the vaccine. It's the first thing that everyone always asks me about, and I've sort of become the resident COVID expert for my community. And so, can you give us an update on where we're at with the COVID vaccine in Washington State?
Happy to. I'm so excited. We received our first doses of vaccine this week. This is a new technology called mRNA vaccines. It doesn't contain any virus. It can't give you an infection. It's relatively easy to manufacture compared to other vaccines. And this particular one hit the ball out of the ballpark with respect to effectiveness. It's much more effective than we were actually willing to settle for. In the initial large clinical trials, it's preventing about 95% of infections, which is phenomenal. So these vaccines are being manufactured. Initially, they'll be in short supply, and that's why the first doses are going to healthcare workers on the front lines that have been taking care of all of us throughout this pandemic, people in hospitals and clinics and long-term care facilities who are at high risk of being exposed to COVID and performing this essential service for us. And then over time, as more doses become available, they'll be able to be offered to more and more people. The exact sequence isn't settled yet. We base our sequencing on recommendations both from the CDC and the Washington State Health Department. But in general, the next groups are likely to be the essential workers who've been out there every day for us, keeping our community running, adults who are older, who are at higher risk of severe disease, hospitalization, and death, and people who have underlying health conditions that also predispose them to serious illness.
I heard that there are a handful of states that are not going to be going through the same list of people in order. Do you think that's going to affect the vaccine here locally? You know, having places like Florida, they've already started vaccinating elderly people. Ohio, I heard they also are going out of order. Do you think that's going to have any sort of impact on Washington State, that every state isn't following the CDC rollout like federal plan?
Yeah, you know, the CDC issues guidance. It's not mandatory, and most people will be following it. It's inevitable that some will, you know, decide that they want to do things differently in their community. We did a lot of stakeholdering. Washington State Department of Health did a lot of stakeholdering with the community and is continuing to do that to try and understand values around this distribution. And we've placed equity and distribution really front and center. So, for example, even with this first tier of distributing to healthcare workers, we want to make sure that we're not just giving to physicians, for example, but to those nurses and to the techs who support patient care and to the people who clean the rooms. So making sure that we're, you know, giving equitable access at every stage of the distribution scheme. There inevitably will be some differences from state to state, but I feel very good about our ability to work with our state health department and our community to have an orderly rollout here to the extent that that's possible, given the uncertainties around the supply and demand. And we don't know how many folks will come forward for the vaccine. We want to be prepared to make it available to as many people as possible, as quickly as possible.
Yeah, that was interesting. I was going to ask you about demand, especially like we're seeing here in the state of Washington, like a lot of states across America, is that there isn't necessarily agreement on wearing masks. There's some restaurants and businesses here in the state where, like, you know, they remain open. And when it comes to the vaccine, and a lot of that is around, you know, political. People might not necessarily want the government telling them how to run their business, or the government telling them how to wear a mask, right? But when it comes to the vaccine as well, we have the political, but then you have historical things. You know, it's a lot of Black people who are like, man, they don't, you know, they don't want the vaccine. There's other ethnic groups as well that, you know, have a historical reason why. Then you have a political reason why. And then you have a scientific or reason argument why the vaccine came too fast. And how are you guys go about gauging the demand? What are some of the indicators that you'll have? I know you have your first line of people that you've already targeted, but how are you going to fill out the demand in the state?
Well, great question, Omari, and you really hit on a lot of challenges here because this vaccine to me doesn't represent the immediate end to the pandemic, but it represents a light at the end of the tunnel. That the end is it's the beginning of the end, but in order for it to work, people have to get it. And I can tell you that there are valid reasons why people are hesitant about vaccines, and I hope that folks do some homework and get information that will allow them to make the best decision for themselves and their communities. But it's completely understandable why people who have been polarized politically to feel that the enemy is public health and not the virus, or the enemy is somebody who wants to tell you to wear a mask to protect yourself and protect your community, but not the virus. The enemy is the virus. And, we understand that people have concerns about vaccine safety. I'm happy to talk about this, but I can tell you that with this vaccine, as with all vaccines, there were no steps skipped in the clinical trials. There were about 40,000 people in the trial for the first vaccine and 30,000 plus for the second one that's on the way. That these trials were evaluated with the same scientific process, the same independent review that every vaccine or medical product gets. They were produced more quickly because the government invested a lot of money and allowed the development, many steps in development to happen at the same time that usually are sequential and take longer to do. But and they also allowed vaccines to be made before they were approved, so that if we found one that was effective, there already would be a supply to roll out. So there were steps taken to make the process quicker, but those steps didn't in any way compromise our ability to understand its safety or effectiveness. With respect to the historical inequities and the distrust that is completely understandable because people of color have been treated poorly in every aspect of our society, including the medical and public health systems. We want to do what we can to provide information to allow folks to make the best decision they can for themselves and their communities. Because if people don't take it, if we have a safe and effective vaccine that people decide not to take, it's only going to further exacerbate those disparities. So lots of issues. I think the key is getting people information that they can use to make good decisions, and also look to trusted voices in your community who can help you make decisions. Your healthcare providers in your own community, and see what they think.
So I heard a really interesting way someone described the way the vaccine was made. People have this misconception that vaccines are where you get a little bit of it, but that's not enough to hurt you, and then your body builds this natural immunity to it. And I heard somebody describe that this vaccine is more like passing the instructions across, so they're not actually giving you you're not getting any part of the virus. Your body's given the instructions on how to fight it. Is that a good way to describe it?
Yeah, that's pretty good. I'll tell you what it is. There's no virus in this vaccine. It's basically a molecular blueprint, that tells your cells how to make a protein. And when your cells make that protein, your body creates a very, very strong immune response and antibodies against that protein. And it happens to be the protein that's on the outside of the coronavirus itself. So we're giving our own cells instructions to make a protein that's on the coronavirus. It's not the coronavirus. There's no virus in this mRNA. The mRNA itself is a molecular blueprint. You just make the protein, your body reacts to that protein and produces an incredibly strong protective response. So you cannot get an infection from this vaccine. This vaccine is basically degraded pretty quickly by the body's normal processes. We have other vaccines like MMR, measles, mumps, rubella, varicella vaccine, and others, where there's a weakened live virus that comes into the body. And those viruses carry their own mRNA, and it's made the mRNA is used by our cellular machinery to create new viruses that we react to. This is a much simpler vaccine. It doesn't have the weakened virus. It has fewer ingredients. It's just that set of instructions that produce that one protein that we then develop an immune response to. So it's simply it's a simpler way to get immunity, but it's not in any way a live virus and cannot cause an infection.
Right. Dr. Duchin, bringing it back here to King County, if you can tell us, what are the rates like right now in the county, and especially for African American community?
Yeah, thanks, Omari. Well, we're at very high levels of COVID transmission right now in the community. Folks should just assume when they go out that they're going to be exposed to COVID if they come into close contact with other people. Our 14-day rate now is over 400 per 100,000 over 14 days. And back over the summer, we were as low as 50 per 100,000 in September. So, 8 times what we were earlier in the year. We're also seeing hundreds of outbreaks reported to us from around the community each week from all sorts of types of settings, social, community settings, workplaces, healthcare, faith-based, you name it. There's lots of transmission happening all across the community. We're also seeing a very troubling increase in hospitalizations, where we're having 20 to 30 people, and lately closer to 30 people hospitalized each day in the county, which is very distressing, because back over the summer, we were just looking at a few people hospitalized each day. And as we heard earlier, our hospitals are kind of full. We're up over 85% or so of all our hospital beds, including our ICU beds, full. They're not all COVID patients, but these are people who also need medical care for important things like heart disease, heart attacks, strokes, cancer, surgeries, for a variety of reasons. So we need to make sure that we have healthcare access for those people and don't fill our hospitals with COVID. But the rates of COVID, both of COVID infection and of COVID hospitalizations and of COVID death, have not been equal throughout the county. From the beginning of this outbreak, we've seen higher rates of infection in our communities of color, particularly in South King County, higher rates in our Hispanic and Black communities, and our Native American communities, Alaska Native, Native Hawaiian, Pacific Islander. So, for example, our Black community is about 3 times more likely than white to get infected or hospitalized, and about 1.5 times more likely to die from COVID. And our Hispanic communities are 4 to 6 times more likely to get infected, hospitalized, and 3 times as likely to die. And this is a reflection of underlying health disparities and inequities and systemic racism in our community that is not unique to COVID. Nobody should be surprised that during a large-scale disaster, those communities who have been undergoing these disparities and structural racism, inequities, and access to good education, healthcare, economic discrimination, lending, home buying, you name it. The same communities have lower access to resources, more people living at homes, more of them are needing to work in frontline essential worker occupations and not able to telecommute like some of the other communities are. This predisposes people to bad health outcomes. And if it's not COVID, you could think of it as Katrina or heart disease. We know there are increased rates of many different health conditions in these communities because of these same factors. So sadly, no one should be surprised, but it's I think because of all the other things that are happening in our community now, something that more people are becoming conscious of and hopefully will be able to address.
Right. And what is King County doing to address those disparities that you've just outlined?
Well, a number of things. I mean, particularly with respect to COVID, we've been trying to stand up as many testing sites as we can in South County, and we're continuing to increase that. We've had a number of advisory groups, particularly the Pandemic and Racism Community Advisory Group that we've been working with, and I'm always very happy to meet with when I get the chance and learn a lot from direct feedback from our community partners about what's happening on the ground and how we can do things differently to help. Recently reached out to a council of minority business owners to also get feedback on how we can help. We're hiring community members to work within the health department to help us engage more effectively with community and provide services that are more valued. And this ranges from our contact tracers to community navigators, provide social support around case and contact investigation. We're also looking at our healthcare providers in the community, particularly at the moment in our African American community, to try and help address issues around COVID vaccination. We have a grant, $500,000 grant to address racial inequities through engagement and equity education with a focus on our Black, Indigenous, and people of color. And we're learning as much as we can from listening about what we can do better, and would welcome suggestions from your listeners as well.
Yeah, so, I mean, one thing I hear a lot from people is I'm expected to go to work, but then when I'm not at work, I'm expected to stay home, social distance, all of the things. Is there anything in there or any room in there for public health to work on ways that we can help keep people home so that, people who are not, really actually essential workers can stay home and not have to weigh the options between feeding their families and getting COVID and bringing it back to their communities?
That's a really important point. What I would like to see is a stimulus package that includes income support, and that could be through small business to enable businesses to continue to pay people when they need to be home to prevent COVID transmission or to decrease risk in the community to benefit all of us, and also allow those businesses to cope with their loss of income related to the restrictions that we need to keep the virus from spreading. I think that's probably the most important thing. The other factors probably are more around social support. So we are working with our contact tracers to provide some degree of financial support, but also more around food security, trying to make sure if people are needing to stay home during a quarantine or isolation period, we can get them groceries and work with them to understand if there are other needs that our social workers and our support teams, engagement teams, and outreach can provide to help people comply. But it's all very costly, and we're really stressed now because the stimulus hasn't come. We're looking at a fiscal cliff, and a lot of the funding for our programs are going to run out. Our COVID programs, we've received nothing basically for our vaccination program, and we're really struggling now to try and get resources, to get these vaccination programs and all this engagement that's necessary in education, partnership with communities off the ground with no resources. So, we're hoping something will change in the near future. It's been a rough 4 years.
Yeah, definitely. I had a follow-up question about that is, so you mentioned the vaccine and having, education and trying to get the vaccine out to these communities and people who are frontline workers. But somebody actually had a question in the comments of, so even if we do vaccinate them, does the vaccine actually slow the spread, or is it just going to lower the rate of hospitalizations and deaths?
Great question. So we don't know yet. The vaccine will definitely give a high level of protection against infection for the person who's vaccinated. It's possible, though, that people who are vaccinated and who themselves will not get very ill can still get infected in the nose or throat, not get sick, but spread the virus to others. And that's one reason why it's really important to continue to wear masks and practice social distancing, even if you're vaccinated initially, until we know more about how well the vaccine does or does not prevent transmission. So, at first, it's not like you can get vaccinated, throw away your mask, and go back to normal, because you may end up spreading vaccine to your loved ones, your family members, your community that way. We're all going to need to continue to practice our COVID safety behaviors, but it's quite possible that these vaccines will have an impact on transmission. And even if they have a minor impact on transmission, the more people that are protected, the more we'll be able to get back to our previous pre-COVID behaviors.
Right. Before we let you go, it's holiday season, and of course, everybody talks wear the mask, social distance. Do you have any special precautions that you're recommending, or King County Public Health is recommending in this holiday season?
Yeah, it's been, a really tough 9 months. I'm exhausted. I'm sure you're exhausted. I'm sure all your listeners are exhausted. It's really hard to maintain these COVID distancing and mask wearing, and, not doing the things we want to do. But unfortunately, we have to, if we're going to stay safe and keep our family safe and our community safe, at least for a bit longer, until we get enough people vaccinated. And around the holidays, people want to gather and they want to travel. And those are things that are really dangerous, unfortunately, right now, because of the level of disease in our community. So my advice would be, don't travel. Traveling is dangerous and risky. If you have to travel, there's good guidance on our website and the CDC website about how to protect yourself and the people you're going to be visiting by quarantining before and after, getting tested if you can. But the best advice is to avoid travel if you can. Also, to the extent that you can keep your gatherings to your family, people who live in your house, I should say, not your family, but your household members. That's the safest thing, because again, there's just so much spread out there in the community right now. People can spread COVID when they look well, they feel well, they're not intending to hurt you, but that virus is just coming out and floating in the air like perfume or cigarette smoke, and it just builds up in the air. People don't know it. And they breathe it in, and the next thing you know, they've given someone the gift of COVID as a holiday gift. And I know that's not what they want to do. So keeping gatherings as small as possible. And again, if people do have to gather, take the precaution of quarantining. If you can quarantine for 14 days before your gathering, you're very unlikely to develop COVID on the 15th day if you haven't been around other people. If you absolutely can't do 14 days, 10 days is pretty good. And if you're able to do that, you'll decrease your risk of being ill and not knowing it, and sharing COVID with your family and whoever you're gathering with. So keeping your activities limited, wear masks to the extent possible, and ventilation is critical. To the extent that you can open up windows and doors and get airflow in your spaces. This virus just builds up in indoor spaces, and even if you can dilute it a little bit, it will make a big difference in decreasing your risk.
All right. Dr. Jeff Duchin, thank you so much for taking the time. And I know you're very busy over there, so I'm gonna throw this out there so we can hook you in. Man, would you be open to coming back at a later date and updating the public here about what's going on, especially our people here in King County and the community that we serve is African American, the BIPOC community?
Absolutely. No doubt. I want to come back, and I really enjoyed talking with you. So let's do it again.
Thank you.
All right, fantastic. Thank you, Dr. Duchin. Okay. We're going to take a break. We'll be right back.
You will.
I don't know why you put such like a hip track underneath coronavirus.
It's the little pleasures. That's what I do. I'm like, it makes me happy. Just like, and then watching those little viruses dance around to the beat.
I'll be honest with you, producer Nikki, Barron, man, your stock is just raising up higher and higher in the city around this show. This is a very important guest that you had here tonight.
Yeah, and shout out to Mary for setting it up over at King County Public Health. She's been such a huge advocate. I've been talking to her since we were in the CHOP, and she's been working on helping me get answers to these questions. So it's been, it's interesting when I tell people like, oh, I this is who I interviewed, or this is who I have coming up. They're like, what? And I'm like, oh, is that a big deal? Because I'm not in journalism. I'd never looked at who was in charge of public health until I started working at Converge. So to me, I'm just like, huh? And everyone else is like, that's like the top dog.
Well, I'll be honest with you. You're doing a good job, kiddo.
Thank
What
you.
I'm saying? And appreciate how diligent you are on this. Few programming notes here. We got one more show tonight. Hopefully, only one. 8 p.m., me, Bobby Steels, Kevin Schofield. We're going to break down what happened today down there at the federal court, as well as possible next steps up there at Cal Anderson Park. Then, of course, you'll see Nikki Barron tomorrow, 11 a.m. morning update show. She'll be bringing you another coronavirus update. Before we get out of here, any last words?
No. I mean, just, consider your holiday plans, just as you recommended. It's up to us now. We have to just buckle down and yeah, it is tough, but we can do it. And when you look out at other communities and you look at places like my hometown where they're 130%, full in the ICU, that could be our reality. So let's not do that. Let's not travel. Let's stay home. Let's socially distance, wash our hands, and wear masks, and make masks fun. Buy some cool masks, learn to make masks, make it a fun activity, whatever you got to do. But other people out there are showing us what could happen if we don't take the advice of the good doctor.
All right. On that note, we're going to get out of here. Like I said, back live again tonight at 8 p.m. We're talking about Cal Anderson Park, and morning update show tomorrow morning at 11 a.m. Until then, catch you later. Peace.